different places and different people are going to have different tolerances for infections, but kids are very, very low risk for disease from this virus in general.
And which
Uh,
age range are you referring to when you say that?
well, really, as soon as you get into anyone that we would consider a kid, the risk is extraordinarily low. Even under 30 years old, the risk of severe disease is very, very, very low with this virus in general. And so when we're talking about kids in grade school, for example, if these children are interacting with adults who've been vaccinated, in general, I'd say that it ends up being a fairly safe way. I would say that it's not completely clear that they won't transmit amongst each other, but even if they transmit to the adults, it's very unlikely that the adults would get sick. And so that's the really important piece there. It's very likely that the kids can still transmit amongst each other if they're not vaccinated. But again, we don't want to lose track of sort of what we talked about at the beginning of the pandemic, which is that so much of everything we were trying to do was to preserve the health of the most vulnerable, the people who are actually getting severe disease. And so this becomes a societal decision. Do we want to do we want to keep the economy and social interactions closed down or greatly limited in order to prevent fairly rare outcomes in kids? Or are we willing to take a little bit more of a risk and allow the economy to open up, maybe because the risk of keeping the economy closed down actually is worse than the risk to a small number of kids getting ill from the virus. So this has been an ongoing discussion this whole pandemic. But to the question at hand, is it safe for kids who are unvaccinated to interact with vaccinated adults? I would say from the vaccinated adult perspective, it is safe at this point. Vaccinated adults appear to be, once you're fully vaccinated, appear to be very, very effectively protected.